So mutations in the DNA repair pathway genes have become a really hot topic in prostate cancer, particularly with the reports from clinical trials like TOPAR-B and PROfound that show that PARP inhibitors have significant levels of activity in patients who harbor these mutations. At this meeting, we saw a lot of presentations that continue to extend on those findings and continue to tell us that not all these mutations are the same. BRCA2 in particular is a marker of sensitivity to PARP inhibitors, but also BRCA1. ATM mutations, which are very common, are consistently a little bit disappointing with low levels of response. We also learned that BRCA2 mutations may be important in early disease, where patients with active surveillance qualified cancers had a much higher rate of progression if they were a BRCA2 mutated cancer than not. So I think we're going to continue to see new and important research on this pathway, and it'll be impactful in selection of treatment for advanced disease, but maybe also for newly diagnosed disease.